Okay, we're connected.
All right. I'm Dave Anderson, and I serve as chair of the Master's Level Psychology Licensed Clinical Psychotherapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. David Stevens.
Present.
Travis Hamrick.
Present.
Rebecca Jabara.
Present.
Bruce Johnson. Lauren Luck.
Present.
Iris Pauley.
Present.
Robert Pedroza.
Present.
Jennifer Schreiner.
Present.
Josh Tangaway. We know is present. Kari Walt.
Present.
I note the following BSRB staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of COMA are not suspended, so we will be conducting this meeting pursuant to the COMA. On February 16th, 2024, we sent notice to the advisory committee meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with a subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that enable members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the office at 785-296-3240 or send an email to bsrb@ks.gov. The recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. Conference call line is active. I checked it before we got started. There's no one currently on the line, but if I hear a beep, I'll let you know.
Thank you, Dave. Okay, the meeting is now called to order and the advisory committee will begin its discussion. First thing we have is the approval of the agenda or any additions to the agenda. Anyone have any additions? If not, I would accept a motion to approve the agenda.
I move to approve it.
Thank you. Second. Thank you. All right, we have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Very good. Those opposed, same sign. Motion carries. Next, we'll do a review and approval of the minutes from our meeting in February. Has everybody had an opportunity to look those over? If so, are there any changes that need to be made to the minutes as they stand? If not, I would accept a motion to approve the minutes.
So moved.
Thank you.
Second.
Thank you. Okay, all in favor of the motion, please say aye.
Aye.
Thank you. Those opposed, same sign. Motion carries. Next, we'll move on to Dave's Executive Director report.
Thank you, Dave. We'll start with some operations update. We are in the process right now of preparing for upcoming graduations for a number of students. So during that time of year, traditionally, we have an increase in the number of individuals applying for licensure. So staff is making preparations for that. Additionally, as other individuals are approaching graduation, Leslie Allen, the assistant director, and I have been scheduling a lot of visits with schools. When I first became executive director of the BSRB, it was back in 2020, and based on the nature of the pandemic, a lot of those meetings that we tried to do back then were remote. And as we've kind of moved forward this year specifically, we've tried to get a lot of those meetings in person. And it's been a good opportunity to connect with individuals in person, answer questions during the presentation and afterward. And so we are continuing to schedule more of those. We have some coming up in the next few weeks as well. So looking forward to helping those students learn about the licensing process, also to give them sort of a advanced information about disciplinary issues to be mindful of as a practitioner, and then give them an idea of all the resources we have for them on the BSRB website. So those presentations are generally well received, and I'm happy to provide that level of outreach. Another operations update I want to make you aware of, we are in the process of switching the BSRB's website. In the next couple of months, we will be switching from our existing provider to a state contract under a company called Granicus. And so the front page of the BSRB website will look different. It should have more functionality, especially for people on mobile devices. But all of the same documents and information should still be on the website, just may look a little bit different, especially the front page. So just want to prepare you for that. We'll be sending something out to licensees as we get closer to that launch date. But we're tentatively looking for launching that about the first week in May. Moving to some legislative updates. We are in the process now where the legislature is wrapping up the main portion of the legislative session. Every spring, the legislature meets from about the second week in January until sometime in April or the beginning of May, sometimes as late as June, but usually by the middle of May, they tend to be done with everything. Right now, they are in a process called conference committee. And so when you have a bill that passes the House and Senate in different forms, the chamber that made the first change or considered it first has the option to agree with the other chamber's decisions and choices. And if they don't, it can go to a conference committee, and then leadership of both committees, House and Senate, come together, resolve items of difference. That's what's going on right now. Specifically, one of the main items they're working on is the budget. There has been a budget bill passed by both the House and the Senate, and they are conferencing on the budget positions. They were conferencing pretty late into the night last night, and I've seen another several notifications today of more conferencing. So I expect they will probably have that completed maybe today, maybe tomorrow, but then likely they are to pass a budget bill this week and then try to wrap up other legislation. And then I think they will be gone for about 3 weeks. They normally do that to allow time for the governor to review legislation, possibly take action to veto certain items, and then they usually come back for a time period called omnibus. And omnibus can be as short as a few days, it can be longer, but that allows the members of the legislature the opportunity to review any vetoes, decide if they want to try to override vetoes, and then pass any additional legislation. Sometimes they get updated revenue estimates, updated human service caseload expenditures for necessary medical expenditures. So that will be coming up probably in about 3 weeks after this week. So, concerning the BSRB specifically, we mentioned earlier this year, our budget goes before the legislature every year. We don't receive any money from the state, but we have a limitation on how much we can spend. And we propose that for the legislature, the governor makes a recommendation and the legislature can make further adjustments. So both the House and the Senate didn't make any changes from the amount of money we requested for our expenditure limitation this year or next year. The balance in the BSRB fee fund was an item that was discussed by the legislature this year. Basically, from about the time period of 2016 to about 2019, the balance in the fund was growing. Back in 2019, the board put forward some pretty big fee decreases, both in application fees and license renewal fees, and that was in an effort to draw down the balance in the fund. Since that point, starting with about 2020, the balance in the BSRB fee fund has gone down from about 2.3 million to about 1.9 million. Some other factors that are part of the reason it's gone down. The board also last year moved to lower some temporary license fees so that all temporary license fees are $50. Additionally, there was a big bill that passed last year that enabled the BSRB to bring on 2 more licensing specialists. And as part of that, the board decided to go ahead and absorb the cost of those licensing specialists without considering raising fees to deal with that increase for that expenditure. When the budget was going before both the House and the Senate this year, the Senate committee reviewed what the agency was doing, looked to see the balance in the fund. They were positive on behalf of the agency and complimentary of the agency's efforts to draw down the balance in the fund. On the House side, they noted the fund balance was still high compared to the 1.2 million in yearly expenditures for the agency. And so they recommended the agency provide a report back on possible ways to decrease fees even further. So the board had a special meeting that was back in February. The board reviewed information, had a discussion about different actions, attempted to review information from other states, but given the short time frame, we were limited in how much we could pull for the information for the board to review. However, in reviewing those fee decreases the board made back in 2019, the behavior analyst profession did not see the same level of fee decrease the other professions had seen. So the board did recommend putting forward a fee decrease for license renewal fees for assistant behavior analysts and behavior analysts by $50, which would match the fee decreases for the other professions that were put in back then. Additionally, the board indicated that there's a number of moving pieces right now. We were trying to collect information on license fees in other states for comparison. The board wanted to review this, but wanted to make sure they had good information for that purpose. Additionally, there's a number of multi-state compacts that have either recently been passed or were in the process of going through the legislature this year. And the board wanted to see what would be the impact of those multi-state compacts on revenue as well before deciding on additional fee decreases. So ultimately, the board recommended putting together a report detailing that information and also the board's plan to review fees further at the July board meeting and also the September board meeting prior to the agency submitting its budget in September. So we did turn that in to meet the recommendation by the House Budget Committee. When the appropriations bill overall was being worked, House Appropriations had a chance to add additional items. The Senate Ways and Means Committee had a chance to add additional items. The Senate did not. The House, there was briefly a proviso that was put onto the BSRB budget. This proviso had to do with prohibiting the BSRB from enforcing an in-residence requirement for the social work profession. And as I worked with members of the legislature following that proviso, it became apparent that there had been some confusion about some of our proposed changes that we were putting through regulation. For a lot of the professions, those proposed changes are opening things up. For example, there's 4 professions that are adjusting their definition of in-residence so that that in-person component that was previously for non-accredited schools could be met either face-to-face or in person, whereas previously the requirement was that had to be met in person if they came from a non-accredited school. So we were able to clarify some of that information and provide some corrections. And ultimately, when the House was doing their appropriations bill discussion, there was a motion to remove that proviso from the budget. So ultimately, it is no longer on the budget for the BSRB, but had a number of conversations on behalf of the board with leadership in the House and also the member of the committee who made that recommendation just to make sure that they were understanding what the board was actually trying to accomplish through its regulatory changes. The next step, as I mentioned, will be for the House and the Senate to come to a consensus budget bill. And then once they do, which I expect them to do today or tomorrow, they will likely vote on that on the House floor and Senate floor. And if that passes both chambers, it'll be sent to the governor. The governor does have authority to do line item vetoes. So when they come back for the omnibus period, the budget may be one thing that they consider at that time. In terms of other legislative updates, I know this is not for your profession, but it has been a major item of interest. So I'll go ahead and kind of provide information on it. House Bill 2484 was a multi-state compact for the social work profession. This is the third multi-state compact for the professions under the BSRB that we have seen in front of the Kansas legislature. Back in 2021, there was a compact for PhD level psychologists, licensed psychologists. It's called SIPAC, and that did pass. It became effective on January 1st of 2022. And that compact is fully functional. Last year, there was a bill that passed that added Kansas to a compact for professional counseling at the clinical level. That compact has not yet become effective yet. They are still in the process of working on their data system and working out the details for that, but it is hoped that that would be effective later on this year. And then this year during the session, the social work multi-state compact is going to the legislature. Each one of these compacts is set up quite a bit differently. Most of the other compacts have the ability to issue a privilege to practice or a certain authorization to practice the limited scope, such as the psychology compact, the ability to do telehealth services or a limited number of in-state days, but it doesn't replace traditional licensure. The social work one really does. What that compact would do is enable states that are part of the compact to be able to issue a multi-state license. And that multi-state license would allow you to practice not only in your own state, but you could practice in all other compact states. So the existing license that states issue would not change. You would still be able to issue those same social work licenses because it's a social work compact, but now you would be able to issue a multi-state license at each level for social workers if they chose to pursue that. And so if they did, then when the compact was fully functional and operational, they could provide services throughout all of those different states without having to pay a fee to all those states or do the continuing education requirements of all those states. So should be really beneficial. But as I mentioned, each one of these compacts is set up quite a bit differently. There were some logistical things to be determined through this one. I think the version that is passed the House and now passed the Senate and has been sent to the governor has some problems in that draft. Instead of enabling the board to issue a multi-state license with a cap for fees, the legislature changed the initial language of the bill to essentially put in a $25 privilege fee for people wanting to practice under this compact. Based on our number of out-of-state licensees that we anticipate losing because of the model that this is proposing, I do expect that we're going to see a decrease in revenue once this multi-state compact is fully operational. The initial version of the bill would have allowed us some flexibility to figure out how many people are going to be practicing on this and set fees appropriately. But with the version that had moved forward, the fee cap is not high enough for us actually to mitigate those lost revenues. So this will be something we'll have to keep an eye on and then kind of see how things work out. And the legislature did say if we do experience a decrease in revenue, we need assistance to bring it back before the legislature for an adjustment. So we tried to take care of this at the front end. It was not able to be resolved by those committees, but we will keep them informed as we move forward. In terms of an implementation date for that compact, though, it remains to be seen. Usually by the time that enough states pass it, the Rules Committee can start meeting to work out the details. It's usually about maybe a year with the other compacts, maybe a year and a half. It was hopeful this one might be a little bit more quick because of the way that it's set up, that states could just offer these multi-state licenses, but it remains to be seen kind of when those rules will be determined. So that is the update on the social work multi-state compact. It is currently with the governor's office. I do expect the governor to sign that bill into law. And so once that happens, we will just need a number of other states to pass the compact. Right now, one state passed it last year, that was Missouri. And then this year it's about 25 or 26 other states that are currently considering it. And I expect most of those states to go ahead and pass it this session, with more passing it next session as well. The only other bill that I wanted to go ahead and highlight for you is one where the board does have some indirect involvement, and that is Senate Bill 307. That has to do with the Kansas Fights Addiction Act. And so basically the board has the authority to appoint a member to a group called the Kansas Fights Addiction Grant Review Board. And that board is made up of a handful of individuals that reviews proposals for addiction services and takes money from federal lawsuits involving opioids and is able to essentially grant money for groups that are providing those types of services. The board is able to appoint one person to that group. In the past, the initial version of the bill was set up for nonprofit entities to be available to seek that funding. Senate Bill 308 amends the definition of entities that can be approved to also include for-profit entities. So that has passed both chambers and was presented to the governor on March 19th and was approved by the governor on March 22nd. So that now has gone into law. The effective date, I imagine, is probably July 1st. It's usually the statute book. And then the only legislative update I want to let you know about, we are moving forward with those regulatory changes that I mentioned before. There's a number of those that'll be helpful for us to be able to have applicants meet the standards for licensure a little easier now. We have gone through the process of getting those approved by the Department of Administration, the Attorney General's office. We went in front of a legislative committee called the Joint Committee on Administrative Rules and Regulations, JCAR. By law, there's a time period for public comment of 60 days. So we held open that time period. We also had an official meeting at the board office for anyone who wanted to come in person and provide additional feedback. So that is all taken, that's all been completed now. The next step will be for the board to formally adopt these proposed changes to the regulations by a roll call vote at a board meeting. And the next scheduled board meeting is going to be in May. At the Joint Committee on Administrative Rules and Regulations, they did request some additional clarifying language concerning a couple of terms. One had to do with synchronous. We mentioned the change to the in-residence definition for a few of the professions, and that essentially added some new language to allow that to be met not only in person, but also through synchronous video conferencing. So they requested some additional language on the word synchronous, so we might be able to add some clarifying language there. And then for the addiction counseling profession, there's a new term that they recommended, the advisory committee initially and the board did confirm to be added, and that is biopsychosocial. And the committee, the legislature did express some confusion over the term biopsychosocial. That is a term that is more commonly used in some of the other professions like social work, has to do with the biological, psychological, and social functioning or well-being of a person. But I am hopeful that we can add some clarifying language without those having to go through the 60-day time for public comment period again. I think the rule is if you could have something be a natural extension of the regulation, not a substantial change, you may be able to move those forward. So that's what we're going to be pursuing. We're going to have a conversation with the Attorney General's office and see if we can make those minor adjustments. And then if that is what the board would like to approve, then at the next formal board meeting in May, the board could vote to adopt those regulations. Then we could get them published. And then about 15 days after that, then they would become effective. So quite a few different technical marks you have to meet, but we're getting close to the finish line and looking forward to being able to use those new requirements to help some licensed applicants. The last items that I'll talk about here have to do with some updates from the last board meeting. The board did meet on March 11th, and one of the items the board received an update on, we've been working with a company called CE Broker as an option for individuals to be able to better track their continuing education hours. And we've been working on a data sharing agreement. I've had some help from the Office of Administrative or Information Technology Services to make sure we have a good data sharing agreement in place and what the data can be used for and what it can't. We're also working on a master service agreement. I've had our legal counsel help out with some of that terminology and just making sure we clearly define the roles and expectations for all parties involved. So we are getting closer to that. I'm optimistic sometime in the next few weeks we might be able to reach an agreement. If that happens, we can start looking at phasing this agreement in with CE Broker. Just want to remind all of you, this is not a mandatory thing for licensees. It's an opt-in type proposal. I think the BSRB would recommend people choose to do this because it could be helpful with the audit process. The idea is that right now, if individuals are pulled for audit, we need to have them provide documentation to prove that they completed their CE hours. Under this agreement, the e-broker would provide a portal to individuals to be able to upload that documentation and assign it in certain categories as well. That way, if someone is pulled for audit, we could do a quick verification through their portal and then be able to approve the person. The audit process would go much more quickly and smoother for everybody involved. So, but as I mentioned, we're trying to make sure we keep this completely as an opt-in type service. So we don't want to make anyone have to use the services if they don't choose to do so, though I think it'll be to everybody's advantage if they do. Additionally, the board talked about background check requirements for licenses. There's a number of surrounding states that have this as a requirement of licensure, and the board did receive statutory authority to go ahead and do this back in 2016, but the board has not made this a requirement for licensure. One of the items that has been discussed is a cost factor. Even though the BSRB would not receive any of this money directly, it does cost about $50 for a KBI to run the background check to make that information available. Part of these compacts do require individuals practicing under the compacts to have had a background check as a condition of licensure. So the board will need to make a requirement, at least for the individuals practicing under the compacts. But the bigger question is, would the board like to make this a requirement for all levels of licensure? So That is yet to be determined, but the board will have more conversation on that topic. Additionally, at the last board meeting, the board received a presentation on a new option for a license platform for a licensing service. There's a group called Acela that last year received a state contract to be able to offer an enterprise licensing system for regulatory boards that would like to offer licenses through their model. And so the board received some information on services they could provide. Right now, we work with the Board of Healing Arts, and we use a company called System Automation. So this would be a change if the board did want to pursue this. But there are about 5 or 6 or 7 other agencies that have already moved this direction. And I think there'll probably be more regulatory boards like the BSRB that move that direction as well. So the board will have more discussion on that as a possible option in the future. The board did make a delegation motion to staff to allow us to expedite certain applicants in rare cases where there's a practicum reference that's unavailable because of a situation to where someone received their education many, many years ago, and the practicum supervisor is either deceased or cannot be located by the school. And what we had been doing in the past is essentially holding those for the board to review, and then the board would give us approval to move forward. But the board went ahead and delegated that authority to the BSRB staff. So now we don't need to hold those if it's only the reason that would be the reason why we couldn't license that individual. So we should be able to move forward that small group of people a little bit more quickly now. And then the board is also having a discussion on possible requirements for jurisprudence examinations. So some of the advisory committees are having discussions about jurisprudence and possible models where that could be effective. And then the last thing is every year the board tries to hold an all-day planning meeting, and they try to come together in person and talk about items that require more in-depth discussion or possibly items for the legislative agenda. And so this year, that meeting has now been set. It will be on Monday, September 30th, 2024. The location has not yet been determined, but we're going to try to set the meeting in Lawrence if we can this year. A couple years ago, it was in Kansas City. Last year, it was in Wichita. So this meeting, we do try to move it around the state. It is an open meeting, so any individuals from the public who wish to attend that meeting are welcome to do so. But based on the facilities that we use, we're usually not able to broadcast that meeting, though, like I said, it is open to the public. And of course, we will have a set of minutes from that meeting that we will post on the website after that meeting as well. So with that, I will go ahead and end my report and see if there's any questions.
Thank you very much, Dave. Any questions for Dave? There's a lot. Okay, see, go ahead.
I was going to ask about the interstate. Is it called an interstate compact or?
Yes. Mm-hmm.
Okay. And what you mentioned was $25 for them to join?
Well, so the way the social work one is set up, or if it's signed into law by the governor, essentially your normal license fees would stay in place if you want to practice only in Kansas as a social worker. So that would be regarded as a single state license. If you would like to have a multi-state license, what it says is that there would be a cost up to $25 in addition to the normal licensing fees. And so if you paid that extra cost and asked to be switched over to a multi-state license, then essentially you would have the ability to practice social work at each of those levels, not just in Kansas, but in any other compact states once that compact became effective.
What I'm thinking is licensed folks in another state, say Missouri, they would only pay $25 to be able to practice in Kansas.
Well, so the compact, the way it works out is that each state that joins the compact would now have the authority to issue not only the existing single state licenses, but also multi-state licenses. So if someone lived in Missouri, they would most likely just do a multi-state license in Missouri. And so right now, if they wanted to live in Missouri and practice in Missouri and Kansas, they would get a license in Missouri and a license in Kansas. Under this model, they would likely let their Kansas license expire and then just do a multi-state license in Missouri, which gives them the opportunity to practice in Missouri and Kansas.
And it would be $25, right? I mean, that's significantly less than what a license fee is.
Yeah, they would still need to have an active license, so they would still pay the normal license fee.
Missouri.
So every state has the ability to determine this cost in terms of the
Okay.
and so Kansas took that approach. The issue really here is that right now the way the system is set up is that if you want to practice in different states, you have to get a license in every state. So this is meant to replace this and provide a more affordable option for people. The issue is though, if it sounds too good to be true, it's probably because it likely is, in my opinion, because basically. We currently have about 22% of our social workers that live outside of the state of Kansas, but currently get a license in Kansas. And so it does come out to about 1,794 people. And if those states all join the compact, we would reasonably expect those individuals to discontinue their license in Kansas. And so that license revenue we will no longer be receiving. However, we don't think those people will stop providing services. We just think they'll provide them under a multi-state license from their own state, which means that we'll still be responsible for investigating complaints if those people provide services into Kansas by telehealth where they travel to Kansas. And we will now also be opening up the door for our in-state licensees with a multi-state license to practice into all the other states. Not to mention the background check requirement and what our staff will need to be doing to review all that information, or the items that will likely come up, because if we're doing a background check, we're going to discover more items, and our investigators will need time to review those items and bring those before the complaint review committee. So it will be quite a bit more work for our staff. And that's why that $25 charge, in my opinion, looking at all the numbers, I don't think it's going to cover the cost to the agency. Initially, what we were looking at is that if we lost those 1,800 people, it was going to be a decrease in revenue to the BSRB every 2 years of about $150,000. So about $75,000 decrease in revenue every year. If we have a lot of people sign up for this compact, then potentially this $25 charge, we could maybe mitigate the cost. And so the loss of revenue would only be about $50,000 every 2 years. But that's kind of a lot of assumptions. We don't know how much additional staff time and things like that. But the issue is the initial bill draft kind of looked at it like we're going to have a cap for in-state licenses and a cap for multi-state licenses. And then we could set those amounts each appropriately based on how many individuals get a multi-state license and how much work it is to oversee and regulate those different classes of licensees. The $25 privilege amount doesn't really make sense with this compact, in my opinion. And we tried to bring that forward, but we had some opposition and people were saying we want to keep fees low. So we did face some opposition. Unfortunately, we weren't able to resolve this issue with the committees, but we're going to continue to monitor it and hope we don't see the level of revenue decrease that we think is likely.
The only thing that struck me was the significant difference between $25 and then what a standard license fee is. That's a huge, I mean, that's more than 4 to 5 times as much. So
I also might just point out, just food for thought, this sounds like they're structuring it very similarly to the nursing compacts. And so what we've seen in nursing is that there's a little bit of a lag time between when a complaint gets reported to the Missouri board with the compact. Then a year can pass before it's notified over to Kansas. And then you have an employee that's been on a restricted license in one state, practicing fully in the new state. So making sure there's alignment in the timeliness of the review, because the unprofessional behavior in the other state would still very much be important to their licensability and appropriateness to practice in our state too. Just food for thought.
Any additional questions? Really good points. I mean, I think there's a lot of uncharted water here, and it's one of the reasons the board has taken a pretty slow approach to how we're dealing with our reserves, because the impact of all of these compacts, and to Travis's point, how that will impact the kind of revenue we have coming in the coming years, we really want to make sure that we're not draining our reserves too quickly and then having to turn around and up licensing fees for everyone else. So if you get any feedback from legislators in your area, you can just let them know that this is occurring in a thoughtful manner, and there's a lot of new things that the BSRB is dealing with. They're trying to kind of pull into their thinking as they deal with kind of make decisions when we don't exactly know how this is all going to play out. Any further questions, concerns?
Yeah, I'll mention one more thing too. There's been a number of discussion points about workforce and about wanting to make sure that, we're helping people get into the profession. And I think in general, the BSRB, the board was very supportive of this compact. We were a proponent, testified in favor of it in both the House and the Senate, just asked that when it's put together, it's put together the right way. But we do think this will help people get more access to services. And so we think that will be helpful. And the growth of telehealth, we definitely have seen. And so, this will be something moving forward. And I think it's likely that we might see some additional multi-state compacts. So I think maybe in a few years, we might be able to look back and kind of make some adjustments, hopefully, to kind of standardize some of these things a little bit more. But I don't want to miss the point that I think these compacts are very, very helpful. The board definitely was in favor of these compacts. Just want to make sure that we, take our responsibility as protecting the public very seriously when we deal with these things too.
All right, thank you, Dave. If there's no additional questions or comments, we'll move on to old business. And our first item, discussion on applicants for LCP taking the EPPP prior to the completion of their 3,000 hours of experience.
Yeah, and so just kind of to frame this discussion, so we began discussing this topic a couple of meetings ago. We had some special meetings in the fall on the BSRB staff, one in particular for individuals from different schools in Kansas that oversee the topic areas for professions that we regulate. So we were able to bring some information forward to some of those representatives from the schools as far as recent changes and statutes and letting them know about the improvements that we have sought and those that have been put into law. There have been quite a few changes in the last few years. We also had a similar meeting with representatives from employers of mental health professionals. And we were able to bring forward a lot of information to them. And then with both groups, at the end of those informational briefings or informational sessions, we opened it up and collected some feedback and listened to some of the thoughts. And one thing that came out in one of those meetings was an individual said, we have some individuals that take the test, the EPPP, to become a master's level psychologist. And they score more than 400, but less than 500. And so they receive their master's level psychology license. They're able to practice. They're able to start accruing their 3,000 hours towards a clinical license. However, because they're not eligible to really apply for that clinical level license until they finish their 3,000 hours, they're not able to take the EPPP again for at least 2 years while they're finishing those 3,000 hours. And so they believe that there are individuals who likely would do better at reaching that 500 level if they didn't have to wait 2 years between taking it for the master's level psychology license and then later taking the same test to try to reach the 500 mark for the clinical psychotherapy license. And so one part of this discussion is the Association of State and Provincial Psychology Boards, ASPPB, is the entity that designs and oversees the test. And we wanted to reach out to them to see if they would authorize us any kind of latitude to address an issue like this, or if our hands were going to be tied from a technical standpoint. So I had reached out to representatives from them. I did have really good communication with an individual. Her name is Christy Cogley. She's the Director of Exam Operations for ASPPB. And essentially what I was informed about was some of this comes down to what the state will allow and, the state's discretion, but ASPPB does sort of provide guidance, and they will not authorize the test to be taken until certain things are met. So what they do say is that the EPPP should not be taken prior to either degree conferral or completion of foundational coursework, excluding practicum, dissertation, and internship. So they do want there to be completion of foundational coursework, but they're going to leave it open to the state if you want to authorize individuals to take it a little bit earlier than degree conferral. So what that means for the master's level is that potentially it would be an option on the table for us to be able to authorize individuals to take the examination again prior to waiting the 3,000 hours. Now, the way that the statute and regulation is set up, it does not allow for that. Someone would still need to be at an appropriate place to where they would be ready to become licensed prior to being able to take the test again. Now, and I should have mentioned this earlier, if someone does take the EPPP once and scores a 500, they don't need to take it again for the clinical level licensure. Once they get the 500 score, even if that was the first time they took the examination, that would be sufficient for both a master's level psychology license and a clinical psychotherapy license. So that 500 would just carry forward. But if they had something where they scored above a 400, but less than a 500, that's the instance kind of we're talking about here, where they would want to take it again to bring their score up to the 500 level. So it is on the table. I do think that we would want to make sure that we have some appropriate checks in place. And I think one of the things that we could have a conversation about potentially would be, what some of those checks might be. I think right now we only allow people to take the examination if they have an active application. So for the clinical psychotherapy license, if they had received the 400, got their master's level psychology license, they really wouldn't have an active application before the board until they had their clinical psychotherapy hours complete. However, perhaps there could be an adjustment that if someone did apply for the master's level psychology license, that may be an area where we could look at some flexibility there, that as long as they had an application before the board for master's level psychology, even if they were able to reach the threshold to get their master's level psychology license, perhaps that would be the area where we could say, if you scored below a 500, we could approve you to take the test again in terms of seeking the 500 level. And Leslie, feel free to weigh in on this discussion too, because Leslie, I know, has reviewed a lot of the applicants that have applied for master's level psychology or clinical psychotherapy, or has, kind of been part of the discussion as we've talked about the EPPP. So Leslie, do you have anything you wanted to weigh in on authorization to take the EPPP?
No, I think you covered it very well.
I had a question. I wondered if having an approved active plan to be working on your independent licensure could be another mechanism by which we'd identify someone as needing to retake the EPPP sooner. Because if you're not working on your 3,000 hours, I don't believe you that you're in a hurry to retake the EPPP. But if you are, then Leslie's got a copy of that approved plan. It may be an opportunity for a different trigger to authorize that. Just a thought.
That could be one. There are also people that are in PhD programs who apply for their LMLP as they're going along that we would want to account for too. I mean, they'll eventually apply for their LP, but if they can have that done before they do, they'd be happy.
So would we. I think it's a sensible idea. To me, it seems like if someone wants to retake it and they're working on their plan and they are willing to invest, it's quite expensive to take the EPPP. And if they feel like they are ready to commit to that and ready to test again, I don't see the harm in letting someone try. I don't think that the EPPP you get better with. Like the number of failed attempts does not correlate to an improvement in your score. Studying does, but can anyone think of a downside?
No, I agree. I think some people have, indicated that a lot of the material relevant to the EPPP is most fresh in their mind as they are closer to having finished their education than by the time they get all those hours done. So I certainly, I certainly understand why people, particularly if they were very close and thought, it's not like I'm going to have to do a huge amount of studying here. And I can't think of any, to your point, downside of allowing this to occur.
I did talk with representatives from ASPPB as far as the frequency by which people can take the EPPP. Some of the other associations have a mandatory amount of time you have to wait in between taking the examination. But if I recall correctly, I believe what ASPPB has in place is that you can take it 4 times within a year. So now your ability to schedule it is kind of one of the determinations, but you don't have to wait, like let's say one of the associations says you have to wait 90 days in between. So, if you are able to take it, I mean, you would be limited to, I guess, the 8 attempts in the 2-year time period, but no more than 4 per year. But that's really the only limitation it seems like they have on their end for that. And hopefully no one needs to take the EPPP 8 times.
And correct me if I'm wrong, Dave, but at some point there will be the EPPP Part 2, but we don't know as of yet when that will be a required part of the examination.
Yeah, well, it looks like it will be required for states that want to use the EPPP, that essentially the Part 2 will be a requirement that if you do the existing, what we call EPPP, they will now be referring to that as EPPP 1, and then the EPPP Part 2 will be mandatory for states as of January 1st of 2026. So we have a little bit of time in between now and then, but that will be coming up. For the master's level profession, though, there has not been a determination as far as how the logistics are going to work as far as the Part 2. The most recent conversation I heard about that was there was a task force, a committee that was kind of looking at what should be the requirements for states that want to license the master's level. And it seemed like the leaning of that task force at the time was that both Part 1 and Part 2 would be a requirement for master's level psychology applicants. However, there were not firm recommendations and there was not a firm decision. It was more of that committee was meeting, having discussions, sharing their preliminary thoughts, but not that it had been decided yet.
Very good. Any additional comments, questions? All right, we'll move on to the next item, continued review of KAR 102-4-3A, education regulation for possible edits. And I think that's also tied to some of our new business.
Yeah, so I included a copy of the regulation in your packet, and I'm going to go ahead and pull up a version of that as well. This is KAR 102-4-3A, which is the education regulation for your profession. This is one of the regulations that is going through the process to be updated, and I'll pull up that version that has the stamps from the Attorney General's office and the Department of Administration, so you can kind of see the changes there. Okay, so very shortly you should be able to see a copy of 102-4-3A. So just kind of a reminder, one of the items that is going through this process, you had previous discussion about sort of removing the distinction between core faculty versus other faculty members, which should help with one of the requirements for programs that may have an issue meeting the requirement of hours taught by core faculty compared to non-core faculty. So you can kind of see that change there. There was also the language that we had talked about in terms of recognizing individuals who receive their education from APA accredited programs. And there was recently at the board meeting, the Licensed Psychology Advisory Committee had a discussion about currently right now for their licensing purposes, they recognize individuals who receive their education from APA accredited programs, and they are interested in adding also programs that are accredited by an entity called PCSAS. And so I think we were going to have the master's level psychology advisory committee kind of look at PCSAS and determine if you think that would also be helpful maybe to add to your regulations as another accrediting body for the purposes of licensure, that if someone received their education, would that be helpful? Would that be appropriate? And so that is part of this, but also kind of in a bigger picture, when someone applies for licensure, most of the professions have a national accrediting body that is recognized. And these education regulations provide some helpful alternative to analysis. So for the other professions, it says either the person received their education from a program accredited by the national accrediting body, or it meets the following program level requirements and the following coursework level requirements. For master's level psychology, it's a little bit different because there's not a widely recognized national accrediting body for master's level psychology programs. But we are asking each of the advisory committees to review those existing program level requirements and coursework level requirements in their education regulation to see if that language needs to be updated, to see if the coursework requirements are still appropriate. And so in a bigger picture, that's also something we wanted to bring before you as part of the conversation this year to see if you had any recommended changes or if you wanted to discuss any part of the education regulation for possible edits.
Leslie, is this also germane to the discussion about the recent incident we had with a school psychologist getting licensed?
When we started talking about it, no, it was not. But this would be where, well, I don't know if you would have to put it in statute that school psychology wouldn't meet the requirements.
Yeah, so just a little background, and Leslie can correct me if I don't get this right, but it currently says, you know, has a degree in psychology from a, like, for example, you could have from an APA approved program, and it does not say clinical psychology, and nor does ours. Simply says you have to have a degree in psychology that meets the following requirements. And so sometimes people take similar coursework, but obviously with a different kind of slant in terms of if they're going into school psychology, the kind of specific work they'll be doing. But technically, Leslie, right, they'll still can meet the requirements as they're laid out now.
Yes. Now, in your regulation, the way we changed it was to add APA to meet program requirements. So they still would have to meet the coursework requirements. Even if it's APA or PCSAS or MPAC or whatever, you know, you choose to put in the regulation. for doctorate level psychology, it's just APA accredited. We don't even look at coursework if it's APA accredited.
It seems like we also had some discussion about maybe broadening some of the categories to allow for some different classes that might fit. And out of that discussion came the idea of possibly surveying educators. Am I remembering that correctly?
I believe so, yes. That you wanted to speak to educators about current coursework and what changes they might think would be good.
I think there was also discussion though on about not just educators, about, you know, as you talked about, Dave, kind of people in the field who see gaps in education and what should be maybe not weighted more, but given maybe more credence on licensure requirements to make them a little bit more prepared for modern psychotherapy and beyond.
Yeah, because it's really, I mean, they've set up their coursework to meet our established criteria because they want their students to be able to graduate, meet this, and get licensed. So they're not likely to change a lot about what they're doing for fear that then their students wouldn't be able to get licensed. So it's a good reminder that a survey maybe of currently licensed folks, because people who've been in the profession for a while might say, having been practicing, I wish now I would have had more educational opportunities in this particular area.
Yeah, I think perhaps, not entirely, but I think if we were to survey only educators, some of them would say, well, you tell us.
I am curious. We've been talking a lot about going to like a nationwide license, and David, you brought up that there's some discussion about doing that for master level psychologists, potentially. When I think about this, I think about like social work is kind of moving in that direction. When the social work discussion was talked about, is there certain requirements for education that they impose when they do the nationwide licensing? Like, are they stating these are the things that you must do, or are they just accepting what the state has put in place? I'm just thinking about that, how that might affect us if we look at that from our standpoint.
Leslie, do you want to comment on that?
Well, the compact for social work doesn't require CSWE accredited program, does it?
I believe it could be that or substantially equivalent, I believe.
Okay,
Most of I mean, it appears to me that a lot of it is driven by CSWE accreditation because the vast majority of social work programs are either accredited or in the process of becoming accredited.
right. That's what I was going to say, that the problem or the difference is social work is very much, I think almost all states require CSWE accreditation or very equivalent education. So there's a standard education that they have to meet. And master's level psychology, it differs from the states who license it at that level.
And there's only a minority of states that do license at this level.
Is it 17 or?
17, yeah. And not all of them call it master's level psychology, but essentially it's regarded as about 17.
So yeah, we don't have that kind of overarching group that approves the educational programs. Because if you have that in place, and then it makes it easier for people to get licensed in different states, and then it makes it easier for these compacts to exist because you have that pre-existing kind of standard already in place. But there was some talk about the APA possibly accrediting master's level programs. I don't think they're there yet, but they had talked about that.
Yeah, I think there's interest in that. I think they're working on that. But I don't know that there's a unified set of standards for that yet.
And of course, if that occurs, then the last thing a university would want would be to make any changes at the state level and then have the APA come in and say, if you want us to accredit you, you're going to have to follow these standards and have these classes, and then they have to change again. Other comments, feedback?
I work with a lot of, obviously I work with a lot of school psychologists. I think there's about 55 or 60 some in Wichita. And several have asked me just this year, if I have an EDS, my master's in school psychologist, how can I become an LMLP or an LCP? And honestly, I don't know what to tell them because I don't know, but looking through this, it's I don't know, some of them are trying to figure out what's the best way to go about this. And because in grad school at Emporia, I had the first year we had a lot of overlap with those that were into school psychology or those that were into counseling or art therapy, or there was a lot of overlap between the different programs that first year. So it's interesting that that's coming up now, and I've got some people here in town in Wichita that are asking me about what can I do, how can I sit for this test, how can I get these courses done, and yeah, considering the overlap of our education back at school, but then the differences with the internships and the trainings and the field work is completely different. So I think it's an interesting thing to think about and to talk about. And I love that they're wanting to do more clinical stuff than school psychology, to be honest.
Yeah, I think it gets back to that issue of the tension between having more providers, but also making sure that they're appropriately trained to do what a license would allow them to do.
Absolutely. And they've asked me, well, does this, this type of work that I do during the day, because I see their work and I know what they do, would that count towards, clinical internship? And mostly I'm saying I don't think so, because it's not clinically pertinent. It doesn't direct to it's, special education testing or behavioral observations, but not necessarily those with mental disorders or illnesses. So it's been a little bit fuzzy, to be honest, but with them and wondering what they can do and what they can count. And I know they're talking to the specialist, the licensing specialist that you've hired. So hopefully they're getting some good direction, but.
So we have approved people, well, one specifically just recently that had a school psychology, but when it was reviewed, the coursework didn't just focus on school psychology. It focused enough on other things that the coursework was approved, but then that applicant has to then, their internship doesn't usually count. So then they have to do 1,500 supervised hours before they can get their full LMLP.
Yeah.
Do the practicum. So there is a way around it if their education was broad enough.
Yeah, and I think I know I think I know who you're talking about. And he's worked really hard on getting the education that he needs to make that bridge to cross that bridge because
Right.
he knew that there was coursework that he didn't have that was necessary. So
Yeah.
Other comments, feedback? Shall we continue that item, Dave? Have people take another look at that regulation and just, as well as I think we want to create some surveys to get out and see what educators, people with licenses, employers think.
Sounds good.
All right, that moves us to new business. You had mentioned jurisprudence examinations, so we'll start with that item.
Okay. So some of the other states, the condition of licensure, they require passage of something called a jurisprudence examination. And jurisprudence examination is intended to ensure that licensees are familiar with the expectations and requirements as a professional in a certain state, that you know the laws that would apply to you in your position. And sometimes it's used for individuals coming from other states. Sometimes it's just a requirement at the beginning of licensure. And so for some of the other professions, they have been looking into this, especially with some of the changes to reciprocity recently, to shorten that time period, which has allowed us to license more individuals. And then other individuals coming into the state because of multi-state compacts. And they were trying to look at it from the public protection standpoint of the board's mission. How do we verify that licensees are knowledgeable about the law? And so for some of the other professions, we had looked at how many other states require it. And for the ones that do require it, how is it handled? So for professional counseling, we did a little bit of research and found that there were maybe 40% of states or somewhere around there that require a jurisprudence examination. And some of those individuals have it set up where they have an agreement with the company that has developed some software to where somebody has to take it periodically, and it's sort of a learning tool. So you will take questions, and then if you get those wrong, you'll have replacement questions, and you'll have to keep going until you pass with enough positive points. Other ones, you essentially have a company that will do this from time to time and charge a certain fee directly to the licensed applicant for taking the examination, having it scored, and the results given to the regulatory board. So we've done some of the research on this to kind of look to see for comparison purposes. I think the issue is though there is a lot of value in making sure that members of the public are protected by making sure that our licensees are aware of all those laws and expectations. Given the current focus on workforce, anything that we might want to add as another requirement for licensure right now is likely to face a lot of opposition. And even though this would not be a fee that the BSRB would collect and use for operations, if there was an additional cost or fee to licensed applicants, we could also expect that that would face a fair amount of opposition as well, even if it is for a very good purpose. So the question really was, we were looking at, okay, how is there a way that we can still accomplish this objective without, coming head on with the issues that might prevent something like this from being implemented? And I kind of wanted to present sort of a creative approach to all of you. I think it is feasible, but I think we will need some help with this. But the board asked each of the advisory committees to discuss the jurisprudence examination. So I do have a proposal that I have started to have some preliminary thoughts about. And like I said, working out the details is going to take a little bit of work. But I've been kind of studying a little bit on ways to motivate behavior. And while I think it is necessary sometimes for us to penalize people if they don't fulfill the requirements, I kind of wanted to approach this differently to give people more of a motivation to want to be compliant with something like this. And so what we were thinking about doing was perhaps putting together a set of questions that could be asked for individuals to make sure they're knowledgeable about the information we want them to be knowledgeable about. But rather than make it a requirement, this could be something potentially the BSRB would offer for free to licensees, perhaps quarterly. And we could do about an hour-long webinar type format where we would actually walk through jurisprudence style type questions with people. And we were thinking about trying to get a service where people could log in with their name, their license number, and be able to essentially take this test live while we're going through these questions. And so we would be able to track their attendance by them logging in, providing their information, and then providing responses throughout that hour. But basically anyone who voluntarily would take that, we would be able to offer an hour of continuing education for free, probably in ethics as well, because this would be going directly to the responsibilities of the practitioner. And so we were kind of considering that model, offering it maybe quarterly, putting together some questions, opening it up, maybe doing it in the evenings or another time that would work for licensees. And then as a test, kind of seeing what level of interest we got from licensees. So instead of making it a requirement and penalizing people or charging them if they don't do it, instead of that, taking a sort of a reverse approach and offer it where it's not mandatory, but you do get the bonus of a free hour of continuing education, especially in ethics, and then seeing how many people just voluntarily sign up for this. So I wanted to throw that out there, jurisprudence as a topic in general, but then also this type of a model. And I can tell you that the main maybe hindrance I could see right now is just coming up with those questions. But if I could get some assistance from members of the advisory committee in terms of phrasings of questions or even topic areas, that could be resolved. So I think I'll stop and see what your comments are and what your thoughts are on that.
Dave and I talked about this earlier. I think it's a great idea because I think he's absolutely right. We've seen just a lot of resistance from the legislature towards the addition of anything that they feel like is kind of over regulating and or particularly when we have so much money in our reserves, they don't want to see us adding cost. So I think it's a really creative way to give people the opportunity, again, to do this on a voluntary basis, more of a carrot than a stick. And I think a lot of people would happily take advantage of that as well. I'm interested in your feedback, Iris.
Yeah, I definitely agree. I thought that is a good approach to it. Staff are always looking for free CEU opportunities, and I think that's a different way to get the ethics one, which that one, it's nice to have a variety. So that'd be fantastic in my opinion.
Yeah, I think it's great. Sounds great. It would be cool, Dave, just to throw it out there. It'd be cool if students could take it as well, just to kind of get a sense of some of that stuff and maybe not count for credit. It wouldn't need to, like most CEU stuff for students, but I could see an ethics class really thinking that's kind of cool to participate in.
Okay, thank you for mentioning that. Yeah, I hadn't thought about that, but I'll make a note on here because yeah, that would be a way to keep track of that, and then we can provide it back to schools if that would be helpful. Yeah, the one wrinkle I haven't quite figured out for some of these individuals coming from multi-state compact, practicing in Kansas. One of the benefits of those compacts is that you're able to practice in different states without having to meet their continuing education requirements. So even though we want people from other states to understand our rules and to follow those, if they're not really being held to our CE requirements, then a free CE may not be a motivator for those individuals. So I haven't quite figured out maybe how to incentivize it for them. But if you have thoughts on that, feel free to let me know too. But yeah, I was thinking with the 7 professions in general, and talking to our complaint review committee investigators, they can probably identify some areas where licensees struggle sometimes because of confusion over the unprofessional conduct, regulation, and language, or some helpful reminders such as, make sure you complete all of your CEs before you renew your license, even if you have time left in your renewal period, things like that. So there's some general topic areas, but I could definitely use a little bit of help from advisory committee members in terms of maybe some of the phrasings of questions. And so we wanted to bring this to the advisory committees to make you aware of this as a topic and then bring it back to the board. So the board wants to, if they want to go forward with something like this, I'll probably be reaching back out to you to get some assistance with some of those questions.
Any other thoughts, comments?
I was just thinking that I think this was mentioned earlier with the rate to get a multi-state license. It is not very much, and so if that went up and then it was discounted if you were out of state, like if you charged 50 instead, but if you took that, then you got a discount off of it. I don't know. I was just thinking because it does. To me, $25 isn't much to be multi-state. And then if you don't have to meet the requirements, then you do worry about how much cowboying it is going to be going on out there. But
yeah, I think this is one of the tricky things about the multi-state compact. I mean, right now, traditional licensure and having to get CEs in every state where you got a license, that's a way of making sure people are at least meeting certain requirements. But under these compacts, now with you only having to get hours in your home state, the other states really don't have the same level of control. And so I think in terms of a discount, the tricky thing about that is for, let's say, the social work multi-state compact, every state issues their multi-state license. And so they would practice into all these states, but those states wouldn't be able to charge a fee or any way to, collect any of that revenue. So for social work, it'd be still kind of tricky. For psychology, the SIPAC compact, you essentially pay a fee to Kansas, which makes up for the cost of compact membership. The SIPAC compact charges the state of Kansas $10 per year per person that practices under SIPAC. But then separately, you have to pay the SIPAC commission something called an e-passport to make sure that you're meeting the standards to be able to practice under their approval. And then you have a yearly renewal fee to practice under SIPAC authority. So for the other compacts, like the professional counseling one and the psychology one, you have essentially that first fee, but then you have the larger amount that's taken care of. For the social work one, now you only really have that small fee. So, but we'll continue to kind of think through this and see. Money is always a good motivator. If we can provide people with a discount, it's just a couple of them. There's nothing that we were actually charging them to practice in the state. They just kind of were sort of opening up the door for them to come in and practice. So.
All right. Thank you all. Have we covered B and C, or do you want to talk some more about that, Dave?
Well, I guess, yeah, we talked about, we were able to purchase sort of a software to be able to do a survey to all licensees under the BSRB this year for each of the different professions. And so we've kind of talked about designing a survey for individuals from the schools to kind of see what their thoughts are on curriculum and subject areas that licensees should know. we also could send a survey to everyone with a permanent license, either as a master's level psychologist or a licensed clinical psychotherapist. Some of the areas that we have asked other professions like social work, we've asked them questions about their licensing examination. We've asked them questions about supervision, specifically remote supervision versus in-person supervision, both from the perspective of people providing that and also those that are receiving it. If there has been any difference in quality of supervision moving to remote. We also have asked questions about continuing education. I know one of your recommendations recently was to lower that from 50 hours to 40 hours, which puts us more in line with the majority of other states for psychology type programs. But that's just a few different areas. So if you wanted to design some survey questions, the way that the social work profession did it for their advisory committee, they essentially discussed a few different main topics at one of their advisory committee meetings. And then in between that meeting and the next one, I put together some draft questions and brought that back. And then the members of the committee took a look at those draft questions and decided, okay, we would like to make adjustments to these two and maybe add a few more. So ultimately, the one that was sent out had 14 questions, but the first few were demographic type questions, make sure we had a good sampling. And then the survey itself took about 7 to 8 minutes to complete. So had a good response rate. Out of the 8,288 social workers, we got responses back from about 2,800. So really good number of responses. It was kept open for about 10 days. So if you wanted to design a similar survey, I'd be happy to help out with that process. Just kind of need some topic areas to maybe draft some questions on and then bring back for you if you think that'd be helpful to collect information from licensees in your profession.
Do we have a consensus to move forward on the creation of said surveys? And I think Dave was asking for if there are particular areas, questions, subject matter to let him know.
The one area that I thought was, I guess, challenging for us at the hospital whenever, and we've invited some students to come in and talk about doing an internship. Most recently, we had the students from Fort Hays come in, and Dr. Karp and myself were able to talk to them about the different programs at the hospital. I'd estimate probably 8 out of 10 of them wanted to work with family and children. And I applaud them for that. That's a wonderful field, but very few of them wanted to work with adults or even those in the, in the Justice Department, which is a tremendous field with a lot of areas opening up. I mean, I suppose it would be nice to address, what is the interest and how's that compare to what really the need is right now, so that schools are educated. Or at least can provide that information.
That's a good point. I think also just how much do students really understand about positions like the ones you're describing versus, doing traditional kind of outpatient work with groups like families or kids or, more traditional outpatient types of services. All right.
I feel like there should be some kind of question about, or education about wraparound services. Like, I just feel like sometimes, those in private practice get so focused on like the testing themselves that they forget to talk to the school who has that kid 8 hours every day. Or, I do mental health evals for the school, and I had someone just ask me this morning, well, do you really need parent interview? Yes, I need a parent interview. Yeah, if parents aren't going to participate, I cannot complete the mental health evaluation, I cannot get, I can't just get the school's view of the kid. I need to get multiple settings. So it seems like there's just kind of and within the schools, we get reports from private practitioners about, well, this kid, based on parent report, has autism. Well, we don't see any of that at school. So it's just frustrating that I feel like there's a piece missing in the education. Even when I was in grad school, there's a piece missing about no matter what setting you choose, whether you choose, to work at a correctional facility, whether you choose to work at a school or private practice, that's one setting. That's one little aspect of what's going on, whether it's with this child or with this adult. And when we talk about services and what's best, if we can get permission to really talk with I mean, I don't know, something there to me is missing about wraparound services. And I know it takes more work to stop and contact all of these people, but to me, I had a mom bring in a kid and said I think he has this diagnosis, and well, but he spends half his time with dad. I want to get dad's view. And then I never saw that mom again because she didn't want me to have dad's view, which told me it was probably different than her view. So I feel like and that's something I've learned throughout the years, but I feel like that's kind of missing, and I don't know how to address that on a survey or how to pull that type of information out, but I just feel like that's something that's missing. I don't know if anybody else agrees or if anybody else sees similar aspects of that, I feel like I want to say yes to a survey, but how to get specific questions is going to be hard.
Dave, could you share the one that the social workers did as a kind of a model for us to look at?
Sure.
That might help us.
Okay. Do you want me to go ahead and send that out after the meeting, or do you want me to go ahead and pull that up now?
Yeah, let's do it after the meeting, give people a chance to kind of spend some time thinking about that.
Okay. When you receive the survey from the social workers, so essentially what we did, we put together a survey that had about 14 questions. Some of those questions were multiple choice, so we could make a nice pie chart so you could see that information. Some of the questions we intentionally left open-ended because we really wanted to hear the direct statements from the individuals who responded. So the report itself is 62 pages, but I don't want that to be too intimidating. If you look at page 2 of the report, you can actually just see all the questions that were asked on page 2. And then if you want to go to a specific question, you can go to that page and see the responses. But we did really want to get information from specific individuals who responded to it. If someone said the exact same thing, we grouped those together and then mentioned how many people said the exact same response. But in general, we tried to keep a lot of that feedback unique. So, but yeah, if you look at page 2, I'll be happy to send an email after the meeting and I'll send a report out. It's also posted on the BSRB website on the page for the Social Work Advisory Committee. Each advisory committee has its own page, and at one of the recent meetings in February, that's when that was distributed, and we went over it with that group. So if you want to pull it up that way, you can do that as well. But I'll send an email after the meeting with that as an attachment.
Thank you. Next item is advisory committee membership. So we worked hard over the last several years to build up our membership and do so in a way that we wouldn't have everybody coming on and off at the same time. So every time a person's 2-year cycle is up, Dave contacts them about if they want to continue. I think people are eligible for 4 terms. Is that right?
That's right.
Yeah. So Travis indicated that he's not going to re-up for us. So we want to take a moment to thank Travis for his participation. It's been great to have you on the advisory committee. And I think in my time on here, to have somebody representing, state hospital perspective has been really enlightening and important, and appreciate your willingness to take a time out of what I know is a very busy schedule to do this.
Thank you, Dave. I don't know if I gave the best input, but hopefully it helped. Uh, Certainly appreciate the time that I got to spend on here, and thank you for all those accepting me on the committee.
I echo Dave's comments and thank you for your time on the advisory committee. The advisory committee terms do go on state fiscal year. So your last meeting on the advisory committee would be our meeting coming up in June. And one of the reasons that we asked to put this item on the agenda today is for anybody who was eligible to be reappointed. I reached out and asked if they wanted to be reappointed. And so with Travis coming off the advisory committee after June, that means that there would be 8 non-board members on the advisory committee. And per the advisory committee policy, there should be no fewer than 3, no more than 10. So that means there would be essentially 1 or 2 openings on the advisory committee. And so what some of the other advisory committees that are meeting this month are doing are asking me to send out a message to all licensees, seeing if anyone wants to self-nominate themselves for consideration, and then provide a resume or CV and a letter of interest. And then I'll collect all that information, provide it back to you in preparation for the next meeting. And then in the June meeting, you can have an open discussion about candidates, mention which individuals stood out to you the most that you think would be the most helpful to add to the advisory committee. And then you could reach a recommendation on adding either 1 or 2 if you wanted to add another member or 2 to the committee. The official power to appoint people to the advisory committee is under the chair of the board. So that would be something that would need to go to the board chair, and then she would have the ability to appoint members at the board meeting in July. So that's kind of the next step. If you wanted me to go ahead and do that like we've done in the past when there have been openings, unless you want to do something different.
Everybody comfortable with proceeding in that manner?
Yeah.
All right, very good. Again, Travis, thank you so much.
Oh, Dave, I will mention one thing, I think it helps to kind of present this proactively. We always ask board members and advisory committee members to be conscious and conscientious of conflicts of interest. And so with this process for members wanting to be a member of the advisory committee, it is very likely, given the size of our licensee pools, that there's going to be individuals who seek a membership spot on the advisory committee that you know personally, or maybe you have some familiarity with. That doesn't mean that you need to exclude yourself from the discussion or from any kind of vote. You're welcome to continue to participate in that. We just know that based on the number of individual groups people take part in, that's not really an issue. Although if you feel like you need to recuse yourself, you can always do that. That's totally at your discretion. But we will send out a message to all licensees if you would like on your own to reach out to any licensees and say, I think you'd be a good member. You want to consider doing that. That is perfectly fine. You don't have to worry about doing that either. But if you choose to do that, that's not a problem at all either. So just kind of proactively thought I would mention that so that you feel more comfortable about this next stage.
Very good. Thank you, Dave. Next area is other topics for 2024. So is that, Dave, just a general request of the group if there are other items they want to be included on agendas for future meetings?
That's correct. Yes. So we will probably have regulations we bring before you if those have not been reviewed in some time, just as a regular function. But if it's other big topics that you would like the advisory committee to tackle, go ahead and leave some time for discussion if people had other items they wanted to have the advisory committee discuss.
Okay, moving on. Any additional agenda items? All right, seeing none. Next meeting date. Dave, you have June 5th. Is that a proposed date?
That is one that we've already kind of put on the calendar.
Okay.
So the information has already been sent out, but unless as we go deeper into the year, if there's items that were unexpected to conflict, we can make adjustments, but otherwise that one is already on the calendar, so. And there's no time on that, so, yeah, sorry about the language of date to be determined, but June 5th, 2024, and I have that on the calendar as from 1 p.m. until 3 p.m.
All right. If there's nothing else, I will accept a motion to adjourn. Thank you all again for your participation and taking time out of your busy schedules. We greatly appreciate that.
So
I
moved.
make a motion. Second.
Okay, moved and seconded. Thank you all. Have a great rest of your week.
Thank you.
Thank you. You
Thank
too.
you.
Thanks,
Bye-bye.
everyone.